Welcome, everyone. Welcome to the 5 Tips to Reduce Pharmacy Costs, and thank you to all of our attendees this morning. My name is Marnie Nesher, President of the Business Journal News Network. This webinar is being presented by the Business Journal News Network and Excellus BlueCross BlueShield. Some quick housekeeping before we begin the webinar. If you have questions during the presentation, please type them into the chat function at any time, and our presenter will answer them at the end of her presentation. Please let me introduce Amy Handelman. Amy is Director of Pharmacy Consulting and has been with Excellus BlueCross BlueShield for over 17 years. She and her team are responsible for working within the field with employer groups and brokers to provide education, support, and make pharmacy savings recommendations. Specifically, Amy and her team review prescribing trends and patterns, clinical developments and impact, and actions that can be taken to assure cost-effective use of prescription medications. In addition to her tenure at Excellus BlueCross BlueShield, Amy has 20 years of healthcare industry experience. She earned her bachelor's degree in 1995 from Muhlenberg College in Allentown, Pennsylvania. Now let me turn it over to Amy.
Thank you, Marnie. Thank you for having me out this morning. So what I'd like to do is set the stage for what the pharmacy landscape looks like right now. Drug is the most widely used benefit by your employees. To put things into perspective, 75% of all healthcare costs are due to chronic disease treatment, largely because of prescription drugs. The cost of prescription drugs has been a focal point in healthcare in recent years. With the drastic expansion and approval of specialty drugs and a declining number of blockbuster drugs going off patent and backlog of generic approvals, it seems that these trends will continue for the foreseeable future. Within a couple of years, 50% of your total drug spend will be specialty. If you look at the pipeline, well over 50% are specialty. If we ask the question, what's driving trends? So we're really seeing it in 3 big drug class categories. We're seeing it in the inflammatory conditions, which are rheumatoid arthritis, psoriasis. We're seeing in the diabetic drug class category, the insulin, the newer agents such as Januvia, Victoza. We also look at Glumetza. And then the other drug class category we're seeing a big trend in is the oral oncology. So if we look at utilization, so that was pretty much trend. If we look at utilization, an average person fills 13 prescriptions a year. That may not be 13 different prescriptions. What I'm referring to is maybe people are on maintenance medications and they're filling that on a monthly basis. Nearly 30% of prescriptions are filled in 2016 required no patient payment. And that was up from 24% in 2013. And this is due to part to preventive treatment provisions under the Affordable Care Act. So we're always mindful of legislative trends that may cause an impact on utilization or trend. However, as more drugs move to $0, it does result in increased plan costs, but it's probably a smaller driver of trend compared to larger issues like inflation and specialty. Most $0 drugs are for preventive care, like tobacco cessation, fluoride treatments, immunizations, which can help reduce medical costs. So through our integration model, knowing a patient's medical issues can help coordinate care to leverage the $0 drugs to reduce overall costs. So with that said, we're going to talk about the value of integration. So the value of integration with Excellus, I can give you an example, is that we're treating the whole member, which results in better health and lower costs. The problem with carve-out, when you have fragmented member treatment, that will result in compromised care and higher costs. So again, referring to Excellus BlueCross BlueShield, with our integration, when medical and pharmacy benefits are integrated, our doctors and pharmacists review prescriptions and prevent dangerous interactions as a team. We have over 20 in-house clinical pharmacists and over 15 medical directors that see every medication under the medical or the pharmacy benefit. They conduct real-time reviews and collaborate with our medical directors to help prevent dangerous drug interactions. 60 to 70% of prescriptions are covered by the drug benefit, and the rest are covered under the medical benefit. Within Excellus, we are managing both the medical and the drug benefit. To ensure proactive provider engagement, it's very important to understand the relationships that your PBM has with the healthcare systems in the community. With Excellus BlueCross BlueShield, we partner with over 10 healthcare systems to better manage costs and to improve the quality around medication management. We have 2 dedicated pharmacists that partner with the healthcare system leadership team and physicians. They provide patient-level detail, up-to-date information on new drugs, drug increases to react to changing markets. I'd like to give an example around Glumetza. On the first slide, I spoke to trend around diabetic medications. Glumetza is a very popular diabetic medication. The price of Glumetza spiked over 1,000% mid-year. That could have cost our health plan an additional $3 million and increased the cost for our employer groups as well. So armed with this knowledge, we alerted our partners, our healthcare partners, the providers, and offered a solution. We sent patient-level detail that were prescribed Glumetza and identified a lower cost, equally effective medication. Some healthcare systems began outreach to those patients to make the switch, and others put pop-up reminders in their system to prescribe the lower cost alternative in the first place. If we did not have these type of arrangements with these healthcare systems, members would have stayed on the more expensive drugs, doctors would have continued prescribing the more expensive drug, our prescription expenses would have gone up, as well as for employer groups, which all in all would have increased the overall cost of healthcare. So the next tip is really to understand your financial offer in detail. So it's very important to understand how your PBM negotiates on your behalf. I'd like to take a minute and talk about Excellus BlueCross BlueShield's partnership with our new PBM, which is Express Scripts, ESI. We are offering the best of both worlds. We are the largest regional healthcare system partnering with the largest national PBM in the country. What that means is Excellus BlueCross BlueShield, we still maintain control of the formulary. We still maintain control of utilization management, which is step therapy, prior authorization. We are partnering with Express Scripts in terms of retail, the network, as well as rebate, as well as offering the best negotiating power because of their size. So we can offer the best financial offer out in the community. When we talk about rebate, the way that it works with Express Scripts is Express Scripts, because of their size and their negotiating power, they provide us what in terms of the best offering. So what they do is they evaluate drug rebate rates and they provide it to Excellus. We review that in terms of financial and clinical. So Express Scripts negotiates the initial offering. Excellus BlueCross BlueShield serves as the check to ensure that we get the best rates and clinically sound justification for our members. So in terms of financial, what's very important to understand with that relationship is that ESI presents great numbers, but it may not be good enough for Excellus. And because of our size, we can go directly because we are the largest PBM regionally. So if we block that drug, we will hurt their sales. So pharma will care about numbers. So again, it's very important to understand the relationship the PBM has with their other partners. So moving on to trend management programs. Excellus offers a comprehensive approach to trend management. When I was referring to earlier is the prior authorization, step therapy, and all of these are all handled by our own in-house clinical pharmacists. So we have a number of programs, again, prior authorization, step therapy, quantity limits, mandatory specialty benefit, split fill program, dose management. All of these programs help control costs. I'd like to give an example of one of them. So in my first slide, when I referred to oral oncology medications, which is driving trends, one of our use management programs is called split fill. In an effort to provide greater patient support and avoid medication waste, we introduced the split fill program. Many of these oral oncology medications have very high discontinuance rates. So this allows doctors and patients to try expensive medications that have serious side effects for a shorter time so they can confirm effectiveness and tolerance prior to paying for a full 30-day supply. So again, it's important to understand your PBM's programs, your trend management programs, which again are also referred to utilization management programs. And lastly, the last tip is take advantage of reporting and clinical consultation. So at Excellus, we offer comprehensive reporting. We will go out to, based on criteria and size, we will go out to our large employer group and we will offer reporting tools to be able to show how we can save you money. We can look at your prescribing patterns as well as offering cost-saving opportunities. We also have, as I mentioned, in-house clinical pharmacists as well as medical directors that are available free of charge for consultations on complex patient cases that may be driving costs. In addition, we have a reporting tool, such as, or you may have heard of it, of a data cube, which you can look in on a regular basis to be able to look at the prescribing patterns as well as cost-saving initiatives. So as a final thought, as pharmacy costs increase, these are the steps you can take to keep costs under control and eliminate dangerous gaps in care. Recognize the value of integration. Seek out proactive provider engagement, discuss your financial offer in detail, understand your PBM's trend management programs, as well as relying on data from reporting and clinical consultations to help drive decisions. We are here to help you fully understand your options. Thank you.
Thank you, Amy. We have already some questions from the audience. Since we have some time here, if I can start, feel free at any time. Anybody else, if you have some specific questions, please continue to type them into the chat function, and I can share them with the audience. The first question I have this morning is, how much do you charge for each prior authorization that you provide?
Okay, thank you, Marnie. That's a great question. So all of our prior authorizations are free of charge. We do not add any additional cost. And it's a great question, as it's very important to understand other PBMs costs. We do know that other PBMs do often charge for each prior authorization. We've seen up to $1.75 PMPM. We also have seen $55 per prior authorization. So again, it's important to understand either within the contract or ask those questions the additional cost of prior authorizations.
Okay, great question. Let me see, 1 second. Another question is, do you own your own specialty vendors? And is that a disadvantage or is that an advantage to employers?
Sure. So as I mentioned, we recently have partnered with Express Scripts. Through Express Scripts, they have a specialty pharmacy called Accredo. We contract with Accredo as well as Walgreens Specialty. So we do offer choice for our specialty vendors. We partner with those vendors. We do not own those vendors. So I would say it's an advantage not to own for our employer groups. When you contract with a PBM that owns their own specialty pharmacy, you have to often wonder or ask, are those prior authorizations, are they more apt to approve the medications just to get more revenue through their own system?
Okay. Let me see. I see another one over here. Can you share an example on how the utilization management reporting can be leveraged to help businesses make more strategic planning decisions?
Sure. So we provide a number of cost-saving opportunities. So when you look at the reporting, you will be able to see if your employer group offers a lot of maintenance medications, if your members are taking a lot of maintenance medications. We have programs that we can offer that offers cost savings, such as mandatory mail, say. So if you have a lot of members using maintenance medications, we could have them, we could require them to go through Express Scripts or Wegmans mail order. So that is one opportunity around the reporting tools. We also have prior authorization and step therapy. So if an employer group does not offer our use management programs, we can show savings around any of our programs to be able to save money.
Another question was if you can talk a little bit more about the data cube that you were previously had mentioned.
Sure. So we have information consultants that run data, and they have that out. You can gain access to that. I don't have a lot of information on it because it's not housed in the pharmacy department. I can certainly provide more information and information consultants contact information where you can go on and you can look at real-time data and see where there's opportunities as well as prescribing habits for that employer group.
Wonderful. And if you have any other questions and you want to type them into the chat function, let me see. Wait a minute. Here's another one. Is mandatory mail for prescriptions as safe as going to a regular retail pharmacy?
It certainly is. So they will make sure that they get the correct location. So it could be at the home, it could be at the business, you could have a vacation home. They do, if they need to pack it in ice, they will. They will not, if it's heat sensitive or cold sensitive, they will make sure that it is delivered at the appropriate times. It will not be left on a front door if it's freezing cold or if it's too hot. They will work with the member to ensure the appropriate time to have that for the member to be home or to be delivered.
Okay. And then here's another one. What if members have questions about their medications?
Sure. So we have an Ask the Pharmacist tool that is available out onto our website where a pharmacist will review and they will get back to them within 24, 48 hours. That is probably the best tool to be able to get a pharmacist response, one of Excellus' pharmacists.
So what would be the website then that they need to go to?
It would be on the Excellus BCBS website. Yep.
All right, let me see if we have any more questions. Okay. Well, that was very informative. If somebody has more questions, they should always feel free to connect with Amy, right? On the presentation, I believe we have your contact information. I think one more, actually, I think if you go one more slide, I think we have that contact information for people to reach out to you directly if you want to talk to her privately afterwards. And we want to thank you, Amy Handelman of Excellus BlueCross BlueShield, and we want to thank Visual Technologies for providing our technical support this morning. And we want to thank everyone for joining us and taking the time this morning out of your busy day. We will be sending out a survey after the webinar, and you will also be receiving the link to this presentation in the next couple of days. So feel free to share the presentation as well with anyone else, or if someone was not able to attend today, we'll make sure we are able to share it with them as well. Thank you, everybody. We hope the content was informative. We appreciate you taking the time again to join us, and please enjoy the rest of your day.